Hi. Now, let's study further about this circulatory system in terms of blood vessel, physiology, and physics. So let's grasp the relationship between radius, resistance, and pressure drop, and distribution of fluid dynamics throughout our body. So first, what is blood? Blood is a circulating viscous flow in our body, which is a multi-phase because blood is composed of not only plasma, which is a clear liquid, lots of containing proteins. However, it also contains a lot of cells, especially red blood cells. So blood is more viscous than water. So let's first start to think about viscosity aspect. Viscosity is how viscous a fluid is. You may feel that honey versus water. Let's see the actual viscosities. So the water is about 0.75 and blood plasma is about 1. And the blood is about 3 times higher than that. So, and in comparison, olive oil is about 80 and corn syrup, which is like honey, which is 8,000. So blood is a suspension of cells, especially red blood cell, which composes of almost 40% of blood volume in a protein-rich fluid, which is except RBCs, and that we call as a plasma. And the viscosity is a physical property related to resistance or to flow or deformation of a fluid. So viscosity is a physical quantity you can define as when the layer of fluid, and you imagine a plate on top while there's a wall here, when you are like pulling the plate, how easy you can pull is related to the viscosity. And more detail will be covered in fluid mechanics. So blood is now more viscous than water, or less viscous than olive oil or corn syrup. So let's understand the fluid flow, especially involved in blood flow. We call it as hemodynamics. And from our familiar circuit theory and Ohm's law relating the electrical current and electric potential and resistance, and those laws can be very similarly applied. So because network of branching vessels with decreasing diameter from aorta, which is the first artery from the left ventricle, to artery, to smaller arterioles, to capillaries. And think about the capillary. The capillary diameter is very, very small. It's approximately the same as those of cells, RBCs, within the flowing blood. Even the capillary diameter can be smaller than RBCs. So the RBC has to squeeze through to pass through. So RBCs, a healthy RBC should be able to be very flexible. Old RBCs tend to be more stiffer, and they usually get filtered and die in the spleen. So RBCs, so capillary is really small. It's approximately smaller or the same as RBC diameter. So which is about like, let's say about order of 5 micron. So because of this, every metabolically active cells in the body, they need an oxygen and nutrient by diffusion. So they usually lie within about 100 micron of the nearest capillary for adequate nutrients for metabolism. And don't trust this number too much because this number can vary from organ to organ. Now think about the fluid motion equation, which is coming from fluid mechanics. So as I discuss you from the system approach and engineering point of view, the fluid flow, we can apply Newton's second law, F equals ma, into this open system by defining control surface, control volume, and the pressure, which is a force from the exerting force, and the movement of fluid through inside and throughout this control surface. And you can apply this to derive the fluid version of F equals ma, which we call as a Navier-Stokes equation. And that you can solve with a very simple geometry such as pipe flow. So by solving that, we will get this. This Q is a flow rate, and the flow rate is this term multiplied by delta P. Delta P is a pressure difference between. And this shape, think about it with the known Ohm's law in electrical engineering, which we know V equals IR or R times I. I is a current, or you can consider I as a charge movement, so charge flow, and equals 1 over resistance times voltage drop. What is voltage drop or potential, which is the driving force for the electrons, electric charges to move? So similarly in fluid flow, the pressure difference makes the flow to move. So this is the driving force, and flow rate is like a current. So this term you can consider as a 1 over resistance. So here the mu is a viscosity, and L is characteristic length, and the R is the radius of a pipe. So if you consider this as a 1 over resistance, you realize important parameter as the diameter or radius of the pipe. So resistance, in fact, is proportional, inversely proportional to the R to the 4th. This is a very important thing to notice. And what it means is the resistance is very sensitive to the diameter or radius of the vessel. So major overall resistance to blood flow, which would be the major part. And you can see those who had smallest radius will have the highest resistance. For example, if a blood flow in the blood vessel diameter is decreased by half, how much of resistance will increase, which is 2 to the 4th, it's 16 times harder to push the blood through with the given, you need for the same flow, you need to increase the pressure difference by 16 times. So this is much harder. So the flow is quite sensitive to the resistance, and resistance is sensitive to the radius. And because of that, local blood flow, eventually the blood get into the tissues such as brain or organs, and that has to be well controlled. Because of the limited blood source, you want to send it to where it's mostly necessary. So local blood flow to a tissue should be well controlled, which is done by constriction or dilation of the arterioles. Arterioles has smooth muscle cells which control this, having muscular walls, and so that it can deliver blood to the adequate place. So I put this as an asterisk, and the reason is people are arguing, asking whether is the arteriole the final controller for our blood flow, and some people argue with that. So for example, David Edwell group from University College London, they published a Nature paper in 2014. The title is Capillary Pericytes Regulate Cerebral Blood Flow in Health and Disease. So not only the arteriole, maybe the capillary self is covered by pericytes, and those pericytes might be involved in this dilation and constriction of the capillary vessel, which is the business end. So this problem is still, under a lot of debate, and people are very curious about who and what is the ultimate regulator of blood flow at the capillary level. So here we go back to the resistance is proportional 1 over R to the 4th. So you can draw this, and when the resistance goes down, the radius goes down, the resistance is dramatically increased. So now, by the same time in history, Hagen and Poiseuille from France, they derive a flow equation. And that has an assumption called a laminar flow. Laminar means sheet-like structure in the flow, and Newtonian fluid. Newtonian fluid, there's a non-Newtonian fluid concept, which means the viscosity stays a constant. It's not function of the velocity. In that regime, we simplify it as a Newtonian fluid. But there are cases for non-Newtonian fluid, which is out of our scope for now, through a cylindrical pipe. So let's see blood vessel as a cylindrical pipe. Then, for the flow to happen, you gotta have a force. In this case, it will exert as a pressure. P1 and P2 difference will make the fluid to flow. Well, think about it. There's a wall. Because of the wall, that wall will drag down the flow. So that wall acts as a resistance. So the resistance to flow is coming from the walls, which is touching the flow. And the driving force is, of course, pressure drop. With this assumption, as I showed you already from previous, the pressure drop throughout this flow will be like delta P is like this. Here, Q is the flow rate, and the other, this is, from this analogy with Ohm's law, this becomes a resistance. So pressure difference between the two ends as a delta P, then this pressure drop will be proportional to the length. So the length of the pipe, so it makes sense. And also think about the viscosity, which is the intrinsic property of dragging resistant to flow, is of course the higher the viscosity is, the higher pressure drop you will need. While the radius, the smaller the radius, the higher pressure drop. Okay, so as a result of viscous forces, the velocity of the flow actually varies across the radius of the pipe. So in this pipe, I have to show you one of this fluid distribution. There, in engineering, there's a well-known condition, so-called no-slip boundary condition, which means when there's a fluid flow, the touching surface and that part, the velocity will remain zero, so it can't move. And a good example is you have, let's say, this surface, like this surface. By just blowing, you can remove all the dust, which especially are stick on the surface because there's no slip condition. So really clean the dust, you have to have real tissue to really swipe to clean the dust which is stick on the surface. So this is called no slip boundary condition. So at the surface, there's a very little or zero velocity, and in the middle, it's higher. So you solve the equation on this, you will get the velocity is maximum at the center, and this velocity profile will look like parabolic shape. So how does this relate to our circulatory system? As we remind you, the resistance is proportional to R to the minus fourth. So the radius will be very important for the pressure drop. So let's have a simple diagram of vascular branching system. We have artery, the first order arterial, it will branch out into second order, third order, and fourth order. And it now become about diameter of 10 micron order. And the capillaries is smallest diameter, which is about, only like a couple of micron order. And then it collects into the venule, which means a smaller vein, and the second, third order venule, and it collects into as a big venule and veins. So what about pressure drop related to this? Here is the place where the heart pumps and high pressure arterial blood is coming in. So that pressure drop comes from aorta, and this zigzag is because the heart is pumping, okay? So it goes dramatically down when it becomes to the arterioles, you can see. And also it comes down again through capillary because it has smallest diameter. And because of that, the pressure is very, very low in the vein. And that's why vein is a system, collecting system. Sometimes it needs a valve so that it prevents the backflow. And of course, you can go to pulmonary artery. So axial pressure drops along the blood vessel in the circulatory system. There comes about 80% of pressure drop in the systemic circuit occurs, you can see from here, which is arterial, and here, capillaries. So now I want to get into two types of fluid flow inside a pipe or blood vessel. It's called laminar flow and turbulent flow. So flows in pipe undergo a common transition from sometimes laminar, so-called turbulent. So with low flow rate, the flow pattern is well behaved or streamlined or layered structure, which means the molecule or particle in this layer will not communicate this layer much. So they don't know each other. They are very well aligned. And that we call as a laminar flow. So think about this, this pipe flow. And if all the flows from here to here to here are well layered and they do not communicate much, we call it laminar flow. And they are usually steady state because it doesn't change much. While you increase the flow rate, then you keep increase, or the distance from here to here is longer and longer, the flow pattern can change. So this eventually becomes not this unstable, which means eddy can appear. What is eddy? Like this is an example of eddy, which is like shedding, and shedding. So it's unsteady and flow becomes disordered and no longer following parallel streamlines anymore. And it becomes chaotic. And that type of flow we call as a turbulent flow. So I want to show you that flow example. This is a pipe and you inject a dye here, then the dye thin layer will go pass through. So this is beautiful and it doesn't mix with others. That is a good example of laminar flow. But if you increase the flow rate, let's see what happens. So that dye can become like eddy forming and it's unstable. So it's actually not steady state because it keeps changing, okay? And this phenomena is turbulent flow. However, luckily in our body, majority of our blood is usually laminar. Let me give you an example. So this is a vein, big vein, and we inject the dye from one side of the vein, which is dark color. You see how clean and layered this part of the dye compared to the rest of the blood. So they go to the same route, but they don't mix because this is a laminar flow. So to understand when the flow becomes laminar or turbulent, we need to understand some cool concept called, invented by Reynolds. So we name it as a Reynolds number. So here comes a Reynolds number. Usually this Reynolds number or number is non-dimensional. So there's no physical dimension so that it can be very universal and called dimensionless. But why is it important? Because it determines the transition from laminar to turbulent flow. So Reynolds number is defined by low velocity diameter over viscosity. So low VD over mu. And this is originated from physical meaning. The upper part is related to inertial force, while lower part is related to viscous force. So you can imagine that like honey. So if it's a very viscous flow, you will have very low Reynolds number. However, in comparison with a viscosity, if there's more dynamics, higher flow rate, higher inertia, then the Reynolds number will goes up. So in pipe flow, people have experimented to see about, let's say, several thousand. Here, like 2000. If it's smaller than 2000, the flow pattern will be laminar. So for example, in systemic circulation, in our body, let's think about it, we can calculate the Reynolds number because we know the viscosity of blood and the density of the blood and the flow velocity. And this is the diameter of the vessel. So in aorta, it's the highest flow rate. So it has high Reynolds number. It's over like 1,000, but it's a little bit slightly below. So it's still laminar flow, which is great, and much lower in the capillary flow. While the exception is ascending aorta can even, when it squeezes, and even reaching pretty high. So that can become temporarily turbulent, but most blood flows are laminar, which is what we need to know. While there are cases turbulence will occur when Reynolds number is higher than 2100. This is usually a pathological condition in our blood vessel system. So in areas of disruption of the normal flow pattern, for example, like our carotid artery goes up and then bifurcate, and then the flow is disrupted, and that bifurcation area is usually what can happen is this obstruction that impinges on the flow within the vessel, or narrowing creates higher than normal velocities, and that then turbulence can occur. So people who has a atherosclerosis, a severe atherosclerosis, having narrowing in the bifurcating area in the carotid, there, the doctors, when you go to see the doctor using stethoscope, sometimes listen what sounds here come, because as we see, when there is a higher Reynolds number, turbulence can occur, and turbulence is shedding these eddies like unsteady, so it generates a sound, and this sound from eddies of turbulent flow can be even listened by the doctor with a stethoscope, and that we call a brute sound. So it's like shh, shh, shh. Then the doctor can notice, hey, you have some problem issue here. We may need a medical treatment or medical attention. So sometimes this turbulence-induced sound can become used our medical diagnosis. Let's talk about arteries and veins. So the driving force for the blood flow is pressure difference. So we already learned that in the respiratory system of our breathing, also there's a pressure difference from the atmosphere to our inside lung alveolar pressure drop. That makes this respiratory ventilation. So P pressure in alveoli minus pressure of this atmospheric makes us to breathe, that pressure difference. In comparison, in cardiovascular system, we can consider two kinds of pressure difference. One is along the vessel, which is axial pressure drop, is driving force for our blood movement along this flow. And another aspect we have to see is look at this blood vessel inside of the vessel pressure and outside interstitial fluid outside. So this pressure difference is important. This inside pressure should be higher than outside to have the vessel inflated, okay? And also, especially in the capillary, where the exchange happens. And this pressure difference determines the rate of water movement out of vessel into the adjacent tissue. So that pressure difference we call the word is in English called a mural. So transmural pressure difference, which is defined in this way. And also cyclic variations in pressure, and especially in heart and arterial side, which is very elastic, which sends this pulsatile flow. So cyclic variation in pressure changes leading pulsatile flow, we can even feel and understand. And that's due to there's smooth muscle layers in vessels, which can contract and dilate in response to our physiological needs. So let's consider the distribution of pressure within our vascular system. This distribution, by the way, can change upon the physiological need. So for example, when you lie down and suddenly stand up, actually the need for the pressure in physically is different, but our heart and our system will respond to that. So for example, from basic physics, you see there's a water pipe, and there's atmospheric pressure near here, there's a pressure P1, and there's a water or blood. Then out of this distance h, the pressure at this P2 will be higher than P1 by the amount of the gravitational force. So the P2 is P1 plus density times gravitational constant G times the distance. So we can have a fun test finding out our radial artery. Radial artery is here. So thumb, so that part, you can, near the thumb part, you can feel the pulse. Can you try it? You can feel the pulse. So feel this pulse, and then try to raise up very high, like a meter high, and then feel the pulse, and then come back, come down. And if you're sensitive enough, you may feel that pulse is different. And when you raise, it's lessened. You can calculate it. Try to calculate, because you remember the previous radial artery is about pressure of 100 millimilli Hg. And let's say the displacement from here to here is up to 1 meter, then what will be the pressure difference, which is density for water is about 1,000 kilogram per cubic meter times G gravitational constant 9.8 meter per square seconds, and H, the distance, is about 1 meter, which turn out to be about like 70 millimilli Hg. So it can have a big change, and you may feel through this self-test. So this is your radial artery. So let's come back to review our actual pressure drop in our circulatory system. So look at our heart, and let's start with the right atrium. So this right atrium collects the deoxygenated blood into right ventricle, and that pushes this blood to the lung through these two lungs as a pulmonary artery, and then it oxygenates and comes back via pulmonary vein to the left atrium. And that left atrium passes the blood into the oxygenated blood into the left ventricle, and that left ventricle is the heart, the biggest pump in our body, because it pushes this oxygenated blood through the aorta throughout upper and lower body. So upper and lower through capillaries of head and forelimbs, and lower body, abdomen, and hind limbs. And that eventually, after the oxygenate and exchanging gas, it will come back. So what about the pressure distribution? So left ventricle, left ventricle contract and expand, contract and expand. And because of that, the pressure is really go up and down, but the average about, normal pressure is 80 to 120, and it goes down. And when it's high is when the heart is compressing. So this part is called systole. And when it's expanding, then pressure goes down, and in that case we call diastole. So systole and diastole, while when we go to aorta arteries, it goes down. Arterioles, it drops dramatically because the radius going down and through the capillary as well. And venular vein, vena cava, it keeps going down, very low pressure. So with that, we'll stop it here. Next time, we will get into anatomy of the heart and the electrical system that coordinate the heart contraction and the cardiac cycle. Thank you very much for your attention.